Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. Today, we are fortunate and excited to host the first COVID-19 vaccine event at our building, in addition to providing COVID-19 testing. I encourage you to sign up to receive our weekly e-blast by visiting caahealth.org to ensure that you are immediately notified of the upcoming events and resources CAA Health has to offer the community. Before we officially begin, and while we wait for a few more people to join, I'd like to introduce myself and tell you a little bit more about the Center for African American Health. I am Yolanda Gotier, the Senior Living Health and Wellness Navigator for the Center for African American Health. For those of you who may be unfamiliar with the work of the Center for African American Health, we have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. We provide community-based, evidence-based disease prevention and disease management programs, events, and services. Of course, you may learn more about our work and our programs by, of course, visiting the website at caahealth.org. As we move through today's session, please feel free to type your questions in the chat box, and we will address them if time permits. It seems like we were just counting down the remaining seconds of 2020, and now here we are, already approaching the end of February. We couldn't let this month pass without us acknowledging that in addition to Black History Month, February is also Heart Health Month. Today, we are focusing the conversation on cardiovascular health and sharing key resources and life-saving strategies. Joining me today is Naomi Amaha, the Vice President of Health Strategies at the American Heart Association in Denver. And I want to send out a warm CAA Health welcome to you, Naomi. How are you? And thanks for being with us today.
Thank you so much, Yolanda. It's an honor to be here, and thank you all for joining.
All right. Before we dive into the conversation, I want to share with you a little bit, with our audience, a little bit of your background information. The American Heart Association is an organization that I'm sure many people are familiar with, but they may not know the details of the mission and advocacy efforts to transform communities. And here at CAA Health, we are all about transforming community. So please tell us more.
Wonderful. Thank you all again for joining. So the mission of my organization is to be a relentless force for longer and healthier lives, which is a mouthful and something that I'm so passionate about. Our organization really strives to achieve our mission through a variety of strategies, from quality improvement around how we treat patients with cardiovascular disease to investing in research to better understand the root causes of cardiovascular disease. You know, one of the things that I'm most passionate about, and it speaks to my experience with the organization, is just advocacy for policy changes at all levels of government and that ability to drive systems changes to better transform our communities.
Okay.
Yeah.
So we often hear a lot about Wear Red Day.
Yes.
And Wear Red Day was recently publicized widely by a number of organizations, including ours, on February 5th. Can you tell us more about the purpose of this initiative and why the American Heart Association emphasizes the campaign during Heart Health Month?
Absolutely. So during Heart Month, and most recently on National Wear Red Day, which is the first Friday of every February, just so you remember for the future, it's an opportunity to amplify our work locally and nationally to not only elevate cardiovascular disease, but the ways in which we can address it. So it's really important that we take time to truly recognize why cardiovascular disease exists, who it impacts, especially those that are most disproportionately impacted by cardiovascular disease. But what are those opportunities to help improve an individual's health, especially if they're more likely to get heart disease or cardiovascular disease. So I love Heart Month. I love the ability to wear red, continue to learn about the mission and the work of my organization and share that with you all, but also those ways in which we can understand the signs, understand if we what those factors are, and understand what we can do to make changes in not only in our lives, but advocate for policy and systems changes to better create healthier communities.
Okay. I also learned in the American Heart Association's 2021 Heart Disease and Stroke Statistics Report that cardiovascular disease is the leading killer of women in the US, and specifically to African American women. Those statistics are even more staggering. Can you expand on those stats for our viewers?
Absolutely, Yolanda. So of African American women ages 20 and older, 49% have heart disease. And only 1 in 5 African American women believe she's personally at risk. And additionally, 52% of African American women are aware of the signs and symptoms of a heart attack. So we break that down. We have an awareness issue, we have a belief issue, and we have an issue that shows us that there's more work that needs to be done to raise awareness, to ensure people know the signs and ensure they feel like they have the support and tools needed to make changes so that they can live a healthier life. So we really also have to look at what are the systemic barriers that impacts one's ability to live a healthy life. That might be access to healthy and affordable food, or the time to prepare meals and not eat out as much. Is their neighborhood a place where they can walk around and get physical activity? So there's so many different aspects, and we really need to make sure that we are carving out time to really dig into those aspects and then learn and explore what we can do so that African American women have the tools and supports needed so that they can combat all of the barriers that we know because of cardiovascular disease.
Okay. We know that there are many ways that people can be proactive about improving cardiovascular health and keeping their heart healthy. We hear about them all the time. It isn't necessarily that we do something with what we hear. So, what I'm asking you is,
Yeah.
will you share some of those strategies with us, especially the ones that we can just easily do?
Yes. So one tool that my organization has is this concept of life's simple 7. So understanding those 7 risk factors that we all need to know, but can also act on to make changes in our lifestyle to achieve ideal cardiovascular health. So that might look like, checking your blood pressure regularly to make sure that you have a healthy range of your blood pressure, reducing your blood sugar, which is a wonky way of saying not consuming more sugar than your body needs, getting physically active, eating healthier foods, so more vegetables, lean proteins and fruits, understanding what your cholesterol rate is and taking steps to manage that. And then two, if someone does use tobacco or e-cigarette products, working towards quitting using those products. So for me, really breaking down what are those things in our everyday lives in relation to living a healthier life can go a long way. And so Life Simple 7 is a great example of that approach.
Okay, thank you. Those all seem very doable. Um, Also, along with the COVID-19 pandemic, it exposed numerous inequities in healthcare.
Yes.
And we know that is why it has disproportionately affected communities of color. Tell us about the American Heart Association's efforts to identify and remove barriers to quality healthcare.
Yes. So one thing my organization believes, and I personally believe this as well, is we all deserve the opportunity to live a full and healthy life. And as you've stated, Yolanda, through this pandemic, we realized that we need to explicitly outline how we will work to advance health equity. So I'm really excited to share, we have developed what is called our 2024 goal, which is really focused on advancing cardiovascular health through removing barriers to healthcare access and quality, and really focusing on 4 specific strategies to champion health equity and reduce barriers to ensure that individuals have the ability to live a healthy life. And some of those strategies include, really investing more in our work around research and discovery, raising awareness to empower and engage communities to reduce their cardiovascular and brain health disparities,
Hmm.
advocating to improve healthcare quality and ensuring healthcare access for all, and really looking at innovative strategies to achieve equitable health and healthcare delivery. So we're very excited. We know that there is a lot of work that needs to be done, but we know it's the right thing to do, and now is the time to really focus on that effort.
Great, great. I also know that many of us are familiar with the term, as are you, and the concept of a food desert. But so many people aren't, and many don't realize that under-resourced communities are often targeted by industries with unhealthy products. How is the American Heart Association working to change this?
Yes. So for those that don't know, that food desert is defined by an area that with limited access to affordable and nutritious food. And in Colorado's, as of I believe July 2020, more than 37% of Coloradans said they were struggling to afford food. So these stats are staggering. And so one thing that we are really trying to do is work towards what are those immediate ways we can support food access, but also what are those ways that we can change systems and advance policy change to improve access to nutritional food. So in the immediate, we work with a couple local health partners in the city of Thornton to host a farmers market, which has been a great resource for the community, especially those that don't have access to healthy produce. We also serve on various food policy councils and within coalitions such as the Blueprint to End Hunger that are working to advance policy change at the state and local level and even federal level as well. So we serve in different capacities to ensure that we are trying to address those immediate needs of our community, but also look at what are those long-term policy and systems changes that we can ensure will help in increasing access to affordable produce.
Okay, and you may or may not have the answer to this question,
Yeah.
but are you doing any local work with some of our grocery stores? I mean, I am always baffled um, by what it looks like to walk into a Safeway or a King Super and be in different parts of our community just to see what exists there for people.
Yeah, no, that's a really great point, Yolanda, because they are a stakeholder in these conversations. So we do actively work to talk with those grocers around what are some strategies that we can partner with them on, not only to promote the produce that they're offering that's healthy to the community to be able to cook with recipes with, but also what are some longer term strategies in terms of the communities that they could serve that they maybe aren't in this moment. So I would say it's really important for us when we are trying to look at what are those larger systemic changes, just to have all stakeholders as a part of those conversations, because we need them to come alongside us in this work.
No, that's good. That's good.
Yeah.
And definitely helpful for our community. What advice can you share with people who may be aware that they need to make some lifestyle changes to improve their health, but feel overwhelmed about where to start? And I'm really speaking about more than I just need to lose 5 pounds.
Yeah. Yeah. So one thing I would say is take a breath. It is a lifestyle change, so it's going to take time. I really feel like people need to think about what works for them. Like, what are the ways in which they can make those changes? One thing that works really well for me is having an accountability partner. So, having this, if I'm cooking for my family, making sure that we're all eating healthy together or taking time to be physically active, or checking in with a friend who I know is trying to make similar changes in their life to see, what worked this week, what didn't. That can go a long way in celebrating successes, but also talking through where there's been challenges. I would also say to make sure you're giving yourself time to reflect. So if you're thinking about, oh, I didn't get a chance to work out enough today, or I didn't get a chance to check my blood pressure, just think about what was that barrier that prevented you from doing that, and think about what could be something that you can do to help make that possible. So is that blocking time in your day? Is that scheduling time with your physician or community health organization that you work with? And then like my two last tips are, celebrate the small wins because they are helping you and making those bigger changes in your life. But also think too about what is your why? Like, what is the reason that you want to make this change? Is it for your loved ones? Is it because you have a personal goal that you've set in relation to your health or achieving something greater? And I feel like having that why will also keep you motivated on those tough days.
Great to know. Great to know.
Yeah.
We are almost out of time, and I
Mm.
want to make sure that we answer any viewer questions that we've received. But before we do, can you tell us about the resources you've shared with us um, that were provided earlier?
Yes. So you guys should probably be seeing those. And if not, we'll send those afterwards. There's a website that's linked to the work that my organization is doing locally. So definitely encourage you to check that out if you're curious on how the AHA is taking action to improve health in the community. And if you want to learn more or get involved in our efforts, definitely check out that site. We've also included some Heart Month resources. So there's a toolkit, some more information about our 2024 impact goal. Also included a link to more information about Life's Simple 7. And one thing too that I love is just our collection of different recipes. So definitely encourage you all to check that out. We want to make sure that we're providing different options for all the types of food that people eat. And then I wanted to share a recent webinar that actually happened yesterday with our CEO and a group of leaders in celebration of Black History Month, talking about women's heart health. So definitely encourage you all to check out those resources and connect with us.
Okay, so you're talking about food, you're speaking about healthy choices, healthy meals. And so one of our questions is, do you have any tips on how to get family involved in cooking healthy meals in a fun way?
Yes, I would say talk to everybody about what kind of food they like to eat. In my family, we love pasta. So one of my healthy substitutes is a zucchini or maybe a spaghetti squash in lieu of pasta. And so I try to talk to everyone about like what do we want to eat today, and look for recipes that maybe have a healthier option, and then include them too in that cooking process. One thing that my husband and I love to do is on Sundays is do meal prep together. And so that's a way for us to connect, but also put together the food that we need to cook during the week. So, and I try to do that at a time that's convenient for each of us. So that's a tool too. And then one other thing that's made it, I wouldn't say it's fun, but it definitely helps, is using measuring cups. So trying to measure out like how much oil that I use or my seasonings. That's been really helpful too. But I think to the extent that everyone's a part of what choices on what you're eating, and then you can do a little bit of work on how you can maybe make that option a little bit healthier, and make sure that they're included in the cooking process, because cooking is what brings people together, and actually sitting down together and enjoying the meal together, because we're so busy. But carving out that time too, I think, can really create that community sense.
Okay, so I have two questions, one of which is, what happens for that cook who's used to, I can look at it and tell how much oil I need? Because I noticed that you said using
Yeah.
measuring tools. So what do you do about that?
I would say for me, that's been a helpful tool just to make sure I'm not using too much oil. I'm probably not as good of a chef as the person that put through that question. So that is just a suggestion that I've used, just in terms of maybe not using too much oil or another product that might be have a little bit too much sodium or salt or sugar. But I would say definitely you go with your gut and what you know. But if you're looking at different alternatives to, maybe like one thing too, if you maybe don't want to use oil, like a cooking spray is something I've used too that has less calories. But again, I always say go with what your gut, but there's tools out there that can help you in making sure you're sticking to right portion sizes and not having too much of things you might not need.
Sounds good.
Yeah.
So is there anything to keep in mind during COVID-19 in shopping for good quality ingredients?
Ooh, that's a good question. I would say, well, I know when I go grocery shopping too, sometimes if I go on a Sunday, there's not as much produce left. So I think maybe trying to obviously go at a time that's convenient and you feel comfortable going. Definitely make sure you're wearing your PPE. But I would say trying to go at a time maybe after that there's been a new delivery of produce, so that you're getting that first pick of what's healthiest or what's the most fresh, because it's just been delivered. I don't know if I have anything else in relation to specific to like COVID shopping. I would say too, just planning ahead, I think, make it a little bit easier process too. And then making sure you're finding time to prep the food too.
Hmm.
Because that, if you don't prep it and then you have a busy day, you might not be as inclined to like go through all the steps to cook it, and then it goes bad. So I think using time, we're now that we were home more, using that time at home to prep for what you want to make during the week and getting some of those ingredients prepared can go a long way.
Okay, and I have noticed that different grocers have different opportunities for fresh foods. And so, do you have any knowledge, and you may not at all, as
Yeah.
to who gets what when?
Oh, that's a good question. I don't know. I know for me, sometimes at the grocery store that I go to, so if I go on a Sunday afternoon, sometimes it is slim pickings. So that could be a question you ask when you go to your grocery store or your local location where you buy produce, is like, when do they get new stuff in? And then maybe you can time when you go to align with that. But yeah, that's a really good question.
Yeah, great suggestion. Make sure you're asking when you're in the grocery store.
Yeah.
One other question: how do you know if an ingredient is heart healthy?
Mm.
And any suggestions for people who are considering going vegan and or plant-based?
Oh, those are great questions. So I know my organization, we do have a heart check that's on a lot of items that's gone through our science and research to show that it's a healthy product. So if you look for that heart check, I would say to reading nutrition labels is great, especially if you're looking at a lot of those things that we find in the center of the grocery store, so processed things and whatnot, just reading the labels to look at what is the percentage of, sodium or other aspects of the ingredients in relation to what your daily value should be. So just looking at that nutrition guide on the back can really help you to, oh, this might have a lot of cholesterol or other aspects. And that can help you too in making some decisions on what options. Um, I don't have a lot of tips personally around vegan or plant-based. I know that a lot of individuals are making those steps, but I'm happy to connect with folks and share some resources around that in relation to those lifestyle choices and what those benefits might be.
Okay.
Yeah.
All right. So we're almost through to the end of our time together. Any last minute recipes, hints, rhymes, rhythms for this discussion?
Oh my gosh. Well, I would just close with it's been such a great opportunity to connect with Yolanda and everyone that's joining us on Facebook Live. And I just want to encourage you all. We all have to do what's best for us, but making these stall steps in trying to live a healthier life will go such a long way. And just know there's so many resources out there, and it can be overwhelming, but just do what you can to do your own research, connect with trusted partners like the Center for African American Health, as well as my organization, the American Heart Association. And we want to be a resource for you all in taking those steps to live a healthier life, because we all should have that opportunity. So it's been so great to join you all. And happy to connect with those that have further questions. Feel free to find me on LinkedIn or other social media platforms. But this has been a great opportunity. And thank you all for joining us and celebrating Heart Month.
Thank you so much for giving us the time, because I recognize that February, shortest month of the year,
Yes.
there is a lot put on our platter to make sure when we're getting those health initiatives out, and especially when we're talking about this Heart Healthy Month.
Yeah.
Yes, we think about it in terms and have those reminders when we're thinking of February 14th, but it's good to know that Heart Healthy Month begins the first Friday in February, and that we can think about and love on our hearts and bodies for all 28 days of February, which will give us the strength to take it through for the next part of the year. So again, thank you so very much. And we are about out of time, but I do want you to know that we will be calling you,
Yes.
and we'll probably be calling you often. So just be ready. And I am hopeful that those who have listened in on this will also understand that they can reach out to the American Heart Association when they have questions. And all the links that you've shared will
Yeah.
definitely give us additional information that we can peruse during the time that we need. Like for those of us who are up at 2 and 3 o'clock in the morning and wondering what to do, we can go to those links that you have provided and say,
Yes.
this is what I can prepare for today. So, with that, I want to again say thank you and to let everyone know that this video will be available along with any other information on the center's website at caahealth.org. And any last minute thoughts or things you want to leave us with?
I don't think so. I wish everyone a good weekend and thank you again for joining us. And just remember, there's so much that you can do to be an advocate for yourself and driving longer changes to better improve the health of our community. So just know that too. We all have an opportunity to lift our voices and be an advocate, and joining this is a part of that. So thank you again for joining us.
You're welcome.
Yeah.
And one final thing, the event of the first quarter of the year is about to happen. As many of you know, the Center for African American Health has always done a health fair. But in light of COVID, we are not able to meet in person. But we are not going to leave you without health information. We have a collaborative Black Health Summit that will take place next Friday, February 26th, and Saturday, February 27th. You can find information on our website and on Facebook. I encourage you to sign up for this free virtual event. And again, that is the Collaborative Black Health Summit, which will take place Friday, February 26th, and Saturday, February 27th. And as always, we want you to do and be your best for our community, your community, everyone's community. And in order to do that, you need to be safe, wash your hands often, remember to practice social distancing, wash your mask, and wear it every time you walk out your front door. Make sure it covers your nose. It's not effective if your nose is hanging out. And we want to make sure that you're able to be with us on our next Facebook Live. So thank you.